Good afternoon. We'll call this hearing to order. This is the Committee on Health and Human Services, Finance and Policy. Today's date is Wednesday, March 16th, 2022. And we do have a quorum present, so welcome everyone. And starting us off with our agenda today is Senator Dornink bringing to us Senate File 3202. And Senator Dornink, I think you've got the record for the longest bill of the day. So with that, Senator, please introduce your bill and welcome to our committee.
Thank you, Mr. Chair and members. It's great to be here. And yeah, this is about as simple as I get a common sense bill. So Senate File 3202. As we are aware, Minnesota, and especially rural Minnesota, is experiencing a significant doctor shortage. This is true in every area of medicine, including podiatry. Some of the very well qualified and experienced podiatrists are not able to practice in Minnesota because of a single date and statute. And with that, Mr. Chair, I'd like to turn it over to my testifier, Dr. Biggie, and he'll explain a little bit more of what this bill does.
Thank you, Senator Dornink, and I neglected to do one thing as we started. I would like to move Senate File 3202 to be before the committee. So with that, thank you for the introduction, and we have Dr. Biggie with us online. So welcome to our committee. Please identify yourself for the record and then proceed with your testimony.
Good afternoon, and thank you for asking me to do this. I'm glad to help out. I hope I can. I'm Dr. William Biggie, practiced family medicine in elderly for 30 years. I also directed a family medicine residency program in a large medical center in another state for 5 years. Recently, our most established podiatrist died. Prior to his death, a couple months before that, he told me that he had gotten up very early in the morning, I think he said at 4 or 5 o'clock in the morning, and made his rounds at the nursing homes and came to the clinic, and after clinic he was going to go back to the nursing homes again to finish his rounds. I think this indicates quite well how busy he was. He also is a very outstanding member of our community, and we miss him a lot. Prior to this, as a board member of the Elderly Healthcare Coalition, where we are establishing a new clinic, we're trying to fulfill the needs of the community. And one of the needs, as I just indicated, is for a podiatrist. And now that his death occurred, this is even more acute. In the meantime, we had an application for a position of podiatry from Dr. Ed Heinrich in Mason City, Iowa, who practiced podiatry there for many years. I've never met him personally, but he was recommended very highly by one of the vice presidents of Mercy One in Mason City, and judging on the quality of the other medical providers that she has sent up to us to be in our local clinic, I highly regarded her recommendation for Dr. Heinrich. Then we found out that due to a little technicality, back when he finished his training, preceptorships were used in Iowa and in other states, and subsequently they put a date after a certain date a residency was required. Of course, this was after Dr. Heinrich had already started practice. So he is unable to practice in Minnesota unless this stipulation is changed, and we certainly hope it is. Understand that a change like this probably would be more extensive than just one person, and there may be others to follow. Dr. Heinrich, at his particular stage in his career, chose to do mainly geriatric podiatry, which is where the greatest need is in our community, as indicated by the story he told me that I just related to you. So there may be others to follow along behind Dr. Heinrich, and certainly it's a very severe problem here. Freeborn County has a much higher percentage of our population over the age 65 than the state of Minnesota. I think it's almost twice as high. So our need is particularly acute, and I hope this technicality can be changed for our benefit and for the benefit of people in the future that need podiatric care. So I'm glad I had this chance to tell you. If you have any questions, let me know.
Okay, Thank you, Dr. Biggie. Members, any questions for our testifier or for Senator Dornink? Seeing none. Senator Dornink, any final comments?
Well, thank you, Mr. Chair. This is just a start. We need to do more to encourage and enable well-qualified podiatrists to practice in our state, including such strategies as loan forgiveness programs. Though changing this state of Minnesota statute will not affect a huge number of podiatrists, there's a potential of bringing a few more quality physicians like Dr. Henritz to Minnesota to help with our shortage. So with that, thank you to my testifier and Mr. Chair and members for considering the bill.
Thank you, Senator Dornink. Members, I will renew my motion that Senate File 3202 be passed and sent to general orders. Does everybody understand the motion? We'll vote. All those in favor signify by saying aye. Aye. Opposed? Motion passes. Thank you, Senator Dornink, and thank you, Dr. Biggie.
Thank you, Mr. Chair.
You bet.
Members.
Next up, we'll have Senate File 3501 brought to us by Senator Draheim as he makes his way to the testifier's table.
Thank you, Chair and members.
Welcome, Senator Draheim.
Got to make sure I have my Diet Coke with me.
Yeah, we want to keep you hydrated.
Yes, tough committee.
Senator Draheim, if you, let's see here, I guess if you want to, you could move your bill and then
Okay.
we'll have it before us and then we'll follow your lead.
Thank you, Chair Aki. I would like to move Senate File 3501 to pass as amended. I have amendment, by the way, members, and send to general orders.
Okay. We have the motion, or the bill is before us. Go ahead, if you want to do the introduction. Do you want to offer that amendment that you're speaking of right away?
I would, Chair, if that's okay. I do have an amendment in front of us. It is the A1 amendment.
Okay, we have the A1 amendment to Senate File 3501. Everybody got a copy of that. It is an author's amendment, so I guess we can just go, unless you've got anything you want to add to that, we can pass it so that we get adopt it. And is that what you'd like?
My understanding, Chair, is that this is a technical amendment to clean up the language on this 130-page bill or whatever it is.
Okay, super. It's
Yeah.
as an author's amendment, it's your choice there. So,
Yep.
okay, members, we have the A1 amendment before us. All those in favor signify by saying aye. Aye. Opposed, same sign. The amendment is adopted. Senator Draheim, to your bill as amended now.
Yeah, first off, I do have a letter from MMA. This is, I don't know if this was in the packets or not. It was. Okay, so members, you should all have that in your packet. This bill is intended to clean up the language for this section for physician assistants. That is the intent of the bill. I did have a visit from someone that opposes the bill right before we went to the floor. So I want to be transparent on that. But up till 11:55 today, I had no one reach out to me in opposition to this bill, and it went through the House pretty rapidly. But I wanted to make sure all members understood that, and I don't know if there's anybody that wants to testify either for or against the bill.
Senator Draheim, I do have a testifier listed, so if you're ready for that, we can call her up.
That would be wonderful.
Okay.
Thank you, Chair.
We have Natasha Chernyavsky. Sure. Thank you. Welcome to our committee.
Yeah. Okay. No.
And before I have you start, on Zoom, I have a hand up. Ms. Clayton, did you did you want to speak to this bill also?
Yes, Mr. Chair, thank you.
Okay, so we'll get you in after this testifier. So please welcome, and please identify yourself for the record and then proceed with your testimony.
Thank you, Mr. Chair, members of the committee. My name is Natasha Chunyavsky, and I am the Legislative and Policy Specialist for Citizens Council for Health Freedom. And I had spoken with Senator Draheim about our concerns and would like to just share them with you today. We are concerned about SF 3501 because it adds the term physician assistant approximately 263 times to Minnesota statute, expanding the scope of practice and making PAs equivalent to physicians despite physicians having over 20,000 hours of clinical training and PAs typically having only 2,000 hours of such training. For example, this bill, PAs are being given the right to diagnose terminal conditions and the power to withdraw or withhold medical treatment for such conditions. And you can reference that on lines 50.7 through 50.10, as well as much more expansion. Our concern is patient safety. In 2018 and 2019, we exposed expansion of scope of practice for ARPNs, and we are here today to oppose this bill on similar grounds. However, if this bill does pass, we would like you as a committee to consider the following amendment to protect patient choice and transparency. For example, requiring PAs to announce their position so that patients are aware that they're not being seen by a physician in that moment. And also requiring PAs to refer patients to a physician if the patient has not recovered or improved within 2 visits with that PA. Finally, this bill is not the way to address physician shortage that we're seeing today. Physicians are irreplaceable, having over 11 years of training prior to practicing. Today, physicians are leaving because of bureaucratic requirements. Consider instead what you can do to keep them in practice and available to patients. Thank you so much.
Thank you. And we'll take testimony online from Ms. Clayton. If you would like to identify yourself for the record, and then you can proceed with your testimony. Welcome.
Thank you, Mr. Chair. Thank you, Senator Draheim, for introducing this bill. My name is Leslie Clayton. I am a physician assistant, and I represent the Minnesota Academy of PAs. This bill is not a scope of practice change bill. This bill is a harmonization bill in order to correlate the changes that occurred in 2020 to PA practice with other statutes in Minnesota legislation. This is simply correcting verbiage so that our current practice statute is in correlation with the other statutes. We have reviewed this bill with the Board of Medical Practice, with the Board of Pharmacy, with the Minnesota Medical Association, with the Minnesota Nursing Association, and the Minnesota Advanced Practice Nursing Coalition. There is no contention against this bill with regards to scope of practice change. PAs already have the ability to diagnose, treat, and manage patients, and have so for the last 35 years in the state of Minnesota. We are not expanding care, we are not expanding our scope of practice, and we are not divulging ourselves from working in teams with physicians. We practice under a practice agreement with physicians in the state of Minnesota. There is no scope of practice expansion on this. It's simply clarifying language in correlation with the changes that were made in 2020 PA practice statutes.
Thank you. Senator Draheim, would you like to comment before we go to member questions?
No, let's do member questions first. I'm
Okay.
sorry, I didn't know there was questions. Thank you.
Senator Klein.
Thank you, Mr. Chair. Thanks, Senator Draheim, for bringing the bill. And I just wanted to respond to the first testifier because I work in a practice at Mayo Clinic where I split a service as a physician with a physician assistant. And I can testify that they see patients in every capacity in which I see patients. We do run our patients by each other each day. But these master clinicians are every bit as skilled and as valuable to patient care as anyone on our physician team is. To sort of imply that they are less capable as clinicians or less apt to care for patients well is simply not clinically true and is actually insulting. With regards to the 2 proposed amendments, to litigate or legislate that a physician assistant would have to announce their status as a physician assistant as they enter a patient encounter is completely unnecessary and overreaching. That is part of cultural practice of medicine. You announce your credentials when you enter a patient's room, and it's not something that we need to place into law. to legislate that a patient would have to see a physician if they hadn't improved after 2 days. Again, I work in a hospital setting where a physician assistant might be doing daily cares for a patient with COVID who perhaps is not improving and perhaps is going to die. And they will care for that patient as well as I could, and there's certainly no indication for us to pass a law that would require me to step in if that patient is not improving after 2 days. This is not a scope of practice bill, and it has the support of my professional association, the Minnesota Medical Association, as well as the nurse practitioners and nurses associations, and I support the bill.
Thank you, Senator Klein. Members, any other comments, questions for Senator Draheim or the testifiers? See none. Senator Draheim.
I just wanted to add a few comments. Last year, PAs in Minnesota provided over 10,000 patients care, and without them, where would we have been? I don't think our health system could function without them. They are an integral part of taking care of patients. Yes, are there medical professionals that have more training? Obviously. In the rural areas, we have fewer options than the metro areas, and I think PAs play an important part to fill in the gaps and assist doctors and nurses and everybody else that works in the care settings. So I think this is just more or less cross-referencing, putting the actual name into statute. So I urge your support.
Thank you, Senator Draheim. Would you like to renew your motion that Senate File 3501 be passed as amended and sent to general orders?
I would. Thank you, Chair.
Okay. Thank you, Senator Draheim. Members, any questions? Seeing none. All those in favor, please signify by saying aye. Aye. Opposed? Motion passes. Thank you. Senator Draheim, you got Senate File 3256. Proceed when you're ready.
Thank you, Chair Ecke, once again. I would like to move that Senate File 3254 be passed and sent to the Finance Committee.
You know what? I do have to, and
56, I'm sorry.
No, I think if you're reading the same thing I'm reading, it did say 54, so we won't hold that against you. But
I have enough bills, so I don't need another.
okay. So, yes. We got that. Senator Draheim moved Senate File 3256. And its final, our next destination will be Finance Committee when we get that far. So, Senator Draheim, to your bill.
And members, did we get a letter in the packets from Minnesota Dental Association? So I just want to make sure all the members were aware of that letter to this bill. So this is Senate File 3256. And specialty dentistry is the chapter of law that it is. It adds credentials for licensing, removes some of the fees. It adds admin fines for licensing that allow for license to lapse for more than a month. It pretty much cleans up the statute and lets them run that without us interfering, more or less. So I do have the Executive Director of Minnesota Board of Dentistry on Zoom for questions, Chair.
Okay, would you, Senator Draheim, would you just like to take questions, or would you like to have her add any comments? I do have her listed for questions also, but.
Okay. Yes, if she wants to add anything, that would be great.
Ms. Anderson, if you want to, I'm just looking, I saw you on the screen there. If you want to join us quick, anything you'd like to add before we go to the members' questions?
Yes, Mr. Chair, members of the committee, thank you very much for having me today. I'm available for questions. There was just a couple things that I wanted to mention The bill is being brought forward by the Board of Dentistry, so we appreciate our authors. It does add a license by credential for dental therapy section that is really to align with other license by credential options that we have in Minnesota for dentists, dental hygienists, and dental assistants. So that's why we're adding this pathway. The fee section, I want to just make it prevalent that we are not raising fees. What we did is we combined two sections to make the statute read better and be more understandable for new applicants. So it includes the initial and the application fee. So we feel that that cleans that up. It adds transparency on what the actual fee is, and then it is more clear to applicants. The administrative fines for licensure for more than a month. I do want to point out the board does already allow a 60-day grace period between expiration and termination. So we really have been flexible with individuals that maybe didn't renew with before expiration, but we allow that 60 days before termination. The newly proposed fees would start to apply several months after this process and allow us to collect these fees instead of opening formal complaints. So typically what we have to do right now, because we do not have another option, is we have to open a formal complaint on the license and go through the license, the complaint process as outlined in Minnesota Statute 214. The problem is that this takes a tremendous amount of staff time, resource, and administrative costs. So the reason we want this change is so that way, with those costs that are typically linked to the complaint and discipline process, we will be, shifting it to licensing staff. It greatly reduces the cost for administrative staff. And then also we believe this is a leaner and more streamlined option for addressing these more minor administrative infractions versus opening formal complaints on licenses. And then also just adding a small fee for mailing list service, which is in line with several other boards, and just so that we can offer this to individuals, we have to have a small fee for that. As you see, the bill is supported by both the Minnesota Dental Association, the State Trade Association, and then also the Minnesota Dental Hygiene Association has indicated support for our bill. Thank you, Mr. Chair and members. If there's any additional questions, I'm happy to answer them.
Okay, thank you, Ms. Anderson. Senator Nelson.
Thank you, Mr. Chair. I'm just curious, looking at the bill, on page 5, there's a new subdivision, most of the page about licensure by credential for dental therapy. I'm just curious, how is that different from our current licensure for dental therapy, for dental therapists?
Ms. Anderson?
Yes, Mr. Chair and Senator Nelson, that's a great question. Thank you. Right now, because we were one of the first states to have dental therapy, we do not have a pathway for dental therapists to actually meet any license criteria coming in from other states. And now there are several other states that have quota or other training programs for dental therapists. So we wanted to, have this pathway like we do for others like hygiene, dentistry, and dental assisting, so they would be able to qualify for license by credential. So we do not have any pathway for them at the moment.
Thank you.
Senator Nelson, follow up?
Thank you, Mr. Chair. Well, we do want all hands on deck. I think that's a good addition. Thank you.
Thank you. Members, any more questions, other questions, comments? Seeing none, Senator Draheim, would you like to make your final comments, and then we'll get the bill moved?
No, I appreciate everybody's time and consideration on these bills, and I guess I would like to renew my motion to pass Senate File 3256 and be sent to the Finance Committee.
Okay, members, everybody hear the motion? We'll vote. All those in favor signify by saying aye.
Aye.
Opposed? Motion passes. Thank you, Senator Draheim. Next up, Senator Benson will bring us Senate File 1257. Welcome, Senator Benson.
Thank you, Mr. Chair. I'd like to move Senate File 1257 will be amended and recommended to move to the Committee on Finance, and I'll get to that, Mr. Chair, but I do have the A6 amendment. If I could move the A6 as part of my explanation.
Okay, thank you, Senator Benson. And the A6 is just your author's amendment, so.
Mr. Chair, we're on the first engrossment, so I can't move it as an author's amendment.
Oh, okay.
But it's a delete everything amendment, and so it will be the body of the bill.
I'm looking for my, okay.
That's okay.
I see the amendment now, so that's okay. That one, do you want to touch on it? I guess you already did. It's a delete all. Do you want to tell us any more about it before we vote?
Mr. Chair, I'll make the bill presentation and some comments to the amendment, and then if we could vote on the A6.
Okay.
Okay?
We'll put the A6s before us. Any questions about that? We'll take a vote. All those in favor of the A6 amendment, please signify by saying aye. Aye.
Aye.
Opposed? The amendment is adopted.
Thank you, Mr. Chair.
And, you know, for those of us that were up here, Senator Abler was commenting earlier, and we removed his mic because we figured we were going to control it. I mean, I
I'm going
think
to
he's
try to
looking
get
for
these
his
hearings
mic.
done quickly, Mr. Chair.
Thank you, Mr. Chair. Much appreciated.
So,
Senator Benson, back to your bill as amended.
Mr. Chair, Senate File 1257 is working to solve a real problem. So in Minnesota right now, pre-COVID, if a nurse or doctor graduated from an accredited school, passed all of their boards, they would go to the Board of Nursing or the Board of Medical Practice, and they would get a fingerprint background check as part of their license. And then, if they wanted to work at a hospital, an MDH licensed hospital, this licensed medical professional would have to get another background check through the BCA, through the DHS Net Study 2.0. And then let's say that nurse wanted to work casual shifts at a nursing home. Another employer, another MDH licensed facility, and a third DHS Net Study 2.0 background check. Well, I'm sure you feel the same way I do. This seems dumb. So for the last 2 years, the Hospital Association, the medical boards, and DHS have been working to try to figure out how these licensed medical professionals can practice in a licensed facility without having multiple and, in fact, redundant background checks. We think the A6 is the answer, but we're here to vet that process. So you would still go through a background check, a fingerprint background check through your health licensing board. But then every quarter, a roster would be sent to the Department of Human Services so they could run it through, they would have the data necessary to run it through their wraparound background check, so that if there was any malfeasance by this licensed professional that wasn't reported to the Board of Medical Practice or the Board of Nursing, that DHS would find it and then be able to report it back to the board. That eliminates those redundant background checks, but still keeps the necessary protections in place. The protections, by the way, that the legislature decided were necessary, this wasn't something random that just emerged. We actually passed the laws that put these background checks into place. And so with that, I would welcome the Hospital Association to provide some testimony as to what's going on with background checks, how this might work, and be happy to answer questions following that.
Thank you, Senator Benson. Welcome, Ms. Mary Krinke with the Minnesota Hospital Association.
Thank you, Mr.
Welcome
Chairman.
to our committee.
Thank you, Mr. Chairman, and it's really very nice to see all of you all in person and to be back after 2 years away from this committee. I've missed all of you, and I mean that sincerely. So I just want to start out by thanking Senator Benson. I got to tell you, there's a lot of other issues that would have been a heck of a lot easier to work on than this one. So I really appreciate her tenacity and sticking with this. I also want to thank the Department of Human Services, in particular Matt Burdick. We've worked side by side with Mr. Burdick trying to come up with something that would meet their needs as well as the needs of the licensing boards. We're at a point with workforce, and I know you all know this, that we have to do everything we can to make it as easy as possible for people to work if they're qualified to work and we have necessary precautions in place. There were a couple ways we could have solved this. We could have dropped the process at the licensing boards and just gone with the DHS process. Or we could have dropped the process at DHS and just gone with the licensing boards. We could have done it one of two ways. We think this amendment being offered today threads the needle exactly as it needs to happen. We are keeping everything in place with the licensing boards. So an individual, a professional would go through the criminal background check and the fingerprinting process with their licensing boards. That stays the same. The element that is new with this amendment is that there will be information sent to the Department of Human Services on a quarterly basis with the names and the license number, and then DHS can do the maltreatment reports that are required. And these maltreatment reports will pick up instances of harm or abuse in Minnesota. So this does have a new element for the boards. They will have to, on a quarterly basis, send that information over to DHS. DHS for the last 2 years has been doing emergency background studies without a fingerprint. So what does this accomplish for us and for others in the healthcare industry? It means that we will be able to go from a 2-fingerprint process down to a 1-fingerprint process, but still have the protections for patients in place. So we think this is a pretty elegant solution, and I really hope that we can get this done. And I just want to thank everybody, and also Ms. Kavanaugh for her good drafting. So thanks, everyone.
Absolutely. And Mr. Chair,
Senator Benson.
I cannot express enough. It's been nearly 2 years we've been trying to solve this problem. And Ms. Kavanaugh, Mr. Burdick, the folks at the medical boards, the hospital association, like the last 24 hours, you scheduling this hearing clarified things for people. And I think this is a workable, elegant solution. I do want to draw members' attention to lines 4.26. Whenever we see data sharing agreements, people think, oh, needs to go to civil law. I'm going to call this out because if civil law would like to see this, they'll have to ask for a re-referral. But my intention is to pass to finance because this data sharing agreement has to do with the structure of the information that is being transmitted. So, for example, rows and columns, or if it's an ASCII file or a .csv file, this information is already public information. We are not sharing non-public or private data. And so it would be, the data sharing agreement would be a matter of format. And Mr. Chair, the referral to finance is because this might add a cost, but it would be under special revenue. And so we would keep you apprised of that as we go to finance and let you determine if you wanted to pull it back into the committee. But I want committee members aware that my referral will not be to civil law and that there might be financial constraints or concerns with this bill.
Thank you, Senator Benson. I also have on the list that Matt Burdick from the department is going to join us with comment rather than just questions. Is that Mr. Burdick? Welcome.
Thank you, Mr. Chair. Matt Burdick with the Department of Human Services. I think with the developments of this amendment, I can keep my remarks very brief and just want to say thank you to everyone that's been involved in working through this, and particularly to our team here at DHS and our partners at the Health Licensing Board. This has been a difficult, and background studies is just a very complicated issue, as I've learned intimately this past year and a half, and so this has been a long time coming. I think we have maybe some very small technical tweaks that we'll work with the author on in terms of the language going into finance. But otherwise, I think this meets the needs that we have. And just for the committee's sake, part of why we're involved here is that we do have that obligation to report to the boards when we have maltreatment findings that we have information on that the boards wouldn't, so that the boards know that information so they can take necessary action. And that's really been the challenge that we've been trying to work through, and we think this amendment gets us there. So just appreciate everyone's efforts on this, and happy to stand for any questions.
Thank you, Mr. Burdick. Senator Abler.
Thanks. They got me a microphone, Mr. Chair, so there you go. Just a comment, well, this is a great bill. It's so overdue and so common sense. I don't know why it didn't start out this way, Senator Benson, so thank you. But I also can't see why it would cost anybody much extra money. And just to notify people who are deciding to ascribe a cost to this bill, the $50 or $100 it's going to take to pull these agreements off the shelf. Please, just, there's some things you just have to do that are your job. So to the boards and the department, this is a part of the ordinary business that you do. So thank you. I hope the bill just gets into law real quick.
And
Thank you, Senator Benson.
Mr. Chair, just process-wise, because the A6 amendment was new and the boards haven't had a chance to look at it, I want to give them a stop before we get to the floor to tell us if there will be any cost associated with it. And if there isn't, we'll pull it out of finance and get it on general orders.
Sounds good. Members, any further questions? Seeing none. Senator Benson, some final comments, and then we can renew your motion.
Thank you, Mr. Chair. Common sense, I think, is what showed up in the A6 today. This is what teamwork among everybody with a common goal looks like, and I think we cleaned some things up, protected the public, made it easier to become a licensed medical professional working in a hospital. And with that, Mr. Chair, I move that Senate File 1257 as amended be recommended to pass and sent to the Committee on Finance.
Thank you, Senator Benson. Everybody have the motion before us. All those in favor signify by saying aye.
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 Opposed? Motion passes.
Thank you, Mr. Chair.
Thank you. Okay, members, next up, we have the Department of Human Services in talking about the background studies update. And with us is Inspector General Moti. Welcome to our committee.
Thank you, Mr. Chair. I do believe we have a presentation, and I believe Mr. Zempel will be sharing his screen. In one moment, so we'll go ahead and get started. For the record, my name is Kulani Moti, and I serve as the Inspector General here at DHS. And we wanted to come forth and give you an update as to the large transition that we're working on for background studies. And I believe someone will be sharing our screen. The PowerPoint presentation shortly. Yes, minor technical glitch. So I'll just go ahead and start. As we all remember, at the beginning of the pandemic, the majority of our public fingerprint sites that we were using began rapidly closing, making it difficult for people to submit the required fingerprint-based background study. So part of our response to that was, under the Commissioner's authority and in consultation with the committee chairs, DHS waived some of the requirements for fingerprint-based background studies and instituted a modified study, which we called an emergency background study. And we have been doing that for a while now and are now moving into our transition. Next slide, please. In last year's special session, legislation was passed to allow for a transition period back to fingerprint-based studies, and that transition period was for 365 days, which will end on July 2nd, 2022. As part of that transition period, DHS developed a phased-in approach to this resumption of fingerprint-based studies. And we began that approach on September 15th, 2021. This phased-in approach allowed DHS to make adjustments as necessary as situations and circumstances warranted, which we did several times for our MDH licensed providers, which we have done studies for. Once in November of 2021, because of the surge in Delta variant, they were scheduled to begin then, and so we delayed it. And then we also delayed it once more in January of 2022, also because of the surge of the Omicron variant. Next slide, please. Currently, we have resumed fingerprint-based studies for providers, but because we were receiving emergency studies for longer than initially estimated last year, we have a request for additional funding for the provider credits based on the increased number of emergency studies that had been submitted since last summer. So that is one of our funding requests that we have going forward, and this credit will be passed through to providers to reimburse them for the emergency studies fee that they would have paid during this time. Also, we continue to have interactions with stakeholders and providers, and I do want to note for the committee that we are starting to hear concerns being raised that there wouldn't be enough time for providers to resubmit background studies by the end date of July 2nd. The background study process does include steps that the provider needs to complete in addition to the study subject submitting a fingerprint that goes to DHS. Given all of these required steps that need to be completed, providers are starting to raise concerns that they will not have enough time to complete everything by July 2nd. So as you can see on here, this is the number of emergency studies received, which is sitting at about 360,000. And we're anticipating that some, not necessarily all of them, would need to be resubmitted in order to receive a fully compliant fingerprint-based study. And with that, I will stand for any questions.
Thank you, Ms. Moti. Members, if you have questions, I've got some here too, but Senator Curran?
Thank you, Mr. Chair. So we appreciate the update. One of the key components during this process was the switch of a vendor for the fingerprinting portion of this. And I don't see an update in the presentation or a mention of it at all. So what I'd like to know is, one, how many of the existing capabilities, and now we just talked about the last bill that Senator Benson had, but how many vendors did we have in facilities or sites providing fingerprinting with the old vendor prior to the shutdown? How many do we have with the new vendor? And also, how many companies did their own fingerprinting, which my understanding was not an existing capability of the new vendor? So if you could cover that to start with, then I'm sure we'll have other questions.
Ms. Moti? I think it's a multi-pronged question, so you got a lot of them there to cover.
I will do my best. Thank you, Mr. Chair, Senator Curran. Currently, with our new vendor, we have 83 public sites that are up and running that are available for appointment. And we're using appointment-based as we implement this as part of, at the time, COVID mitigation strategies and to be able to facilitate this large transition. Prior to, let's say, March of 2020, we had anywhere from 80 to 85 sites that were available, but under the previous vendor, but not all of those are public sites. So one of the major differences between the two contracts is that all of the sites that we have through this location, all 83 of them, are public. That was not true under the other site, under the other vendor contract. There is also a pathway for private entities to purchase equipment if they meet some minimum standards that are set out in our overall master contract with that. And we do have 17 private entities that either purchased or in the process have been approved to purchase and are in discussions with the vendor at that time. So right now we have 83 sites across the states that are up and running, and I know our vendors is continuing to stand up additional public locations and anticipating the increase of volume in the future.
Ms. Moti, I'm going to jump in with a question about what you just stated there. You talked about the public sites, and then you kind of had, I caught kind of a void, but then you went on to the private sites. So is that it? The public would be for anybody that showed up and needed this type of service, and the private would be a business that only does their own employees? Is that the difference between the two, or being you specify public and the others are different? Where do we land on that, or what is the proper description?
Yes, Mr. Chair. The 83 public sites are available to through an appointment-based system to anybody who is any study subject that needs to complete a fingerprint or submit a fingerprint. In addition to that, there are 17 private entities that either, like I said, purchased or that would be able to do the fingerprinting at their own location for their own employees.
Okay. Thank you. Senator Curran.
Mr. Chair, along that line of questioning, I think part of it was, my understanding that was a challenge. We didn't have that capability for a private entity initially How many entities prior to the new system also had utilized the private option? Just trying to understand the scope to make sure we had at least the same capabilities as the old vendor, and especially for those that did it privately for their own entity.
Ms. Moti?
Thank you, Mr. Chair, Senator Cran. Prior to that, under our old contract, as I said, we had about 80, it fluctuated anywhere between 80 to 84 sites, and that was a combination of sites that were accepting to anybody who needed, so it was referred to as public, and those that just had, were only doing fingerprints for their own employees. And based on how that other previous contract was structured, we don't have a very good idea of what that combination is. We believe it was about 40% public and about 60% private, but that also then caused a lot of people who may not have access to an entity that was fingerprinting their own people to drive considerable distance or be considerable distance to a public site. So one of the things that we really took on as part of this new contract was to make sure that we had public sites available across the entire state, in addition to any of those private entities that were approved to purchase sites on it, really looking to make it equitable for all people requiring to have a background study. So that's why there's a difference in structure.
Mr. Chair.
Senator Coran.
Thank you. I appreciate it. And what I'd like to know is we know entities that had their own expressed frustration early on. And so what communication was made with them that the physical locations that now they're all public, that's great. But there's still a transportation and a timing in the ability to schedule and capture these employees or to get through the process to retain them before they go off and are hired by another company. I personally just had to do this through the new fingerprint entity, and it wasn't the easiest process. These aren't businesses that are exclusively designed to meet their needs, and so I think a business that is deemed and has a high enough volume, were they considered? And today I was up, my closest was I live in North Branch, it was Pine City. The poor guy there had 3 or 4 other customers, paying customers to work on in addition to this. And so I see that being a big challenge. This time matters, that travel time to an entity, and to go through the process when it's not their priority is problematic. So we have a huge backlog, and so we'd love to see some creativity. I know Senator Benson's bill is moving towards that, but I think we got a big challenge on our hand, not only to get caught up, but those people seeking employment and the employers who depend on it don't have all the time in the world to just drive anywhere and or to be in a facility where it's not a priority for them to take care of this transaction. So thank you.
Thank you. Ms. Moti? Was that, Senator Coran, more a comment? And
that was just a comment, Mr. Chair.
Okay.
Thank you.
Okay, sorry about that.
Thank you.
Senator Abler.
Thank you for the feedback.
Oh, thank you, and thanks again for the microphone. Funny world here. This has been discussed like forever. It's not even Groundhog Day anymore, and we're still discussing this. And Ms. Moti and others have just been faced with the most challenging mountain to climb, with the need for people to feel safe and their staff and all of that. And I don't have any criticism of their intentions and the best they could do. But Mr. Chair, if you would have advertised for testifiers, for witnesses to come and say, how is it going in your niche in your industry, we wouldn't have time in the rest of the day to hear 2 minutes from the crowd, because it is not going all as well. I just talked to a person who's down here all the time yesterday. 4 people drove to Duluth from whatever distance away with whatever means they had, not high-paid workers, and they got to the place in Duluth and it was closed. And, Ms. Moti, I've talked to the commissioner and you and whoever else will listen, and it's not your fault, but this is a huge undertaking, and I'm just helping you understand that all is not well. And in my communications with the commissioner, who has tried harder than anybody to make this thing work, at some point you have to move forward and just to do it, but all is not well. And just because people don't complain to you, Ms. Moti, or to the commissioner directly, doesn't mean that they're just not languishing out in the hinterlands. And if you want letters, I think if you said, hey, tell me how it's going, they would be happy to write you. I think the reason people don't write is because they think it just doesn't matter. And we know you pretty well. We know that you deeply care about this, and you're trying to organize this effort in COVID times and, you know, and all that. But just want to make it clear that there are many places that are just suffering through this, especially in a time when they can't find people that want to work anyway. And even though some of the details and the nuance of the forms and the timing, and in some cases it's 2 weeks, then your time expires, you have to wait and start over again, and there's some exception you can get, but nobody knows this stuff. These people are trying to keep their businesses open and just even working shifts to cover the critical essentials of their clients, because now they're administrators and their frontline staff. So I hope when you hear from them that you understand that there's still more to be done. And I personally am not satisfied with how it's going with the vendor, and a lot of others aren't, and they're probably happy I'm bringing this up. So hopefully it's a respectful comment. And I know you keep working, but so please keep doing your best, but just know it's not fixed all the way. Thank you.
Thank you. We'll go next to Senator Benson.
Thank you, Mr. Chair, and thanks, Ms. Modi. And you and I have been going back and forth on this for a long time, and I was concerned about throughput capacity, and it appears that we're having some capacity issues. Are there any performance requirements in the contract that they have machines, that they have the fingerprint technology and individuals available for a number of hours a day or a number of hours a week? Is there any leverage we can use to push this vendor to make sure that we've done everything we could to reduce the bottleneck instead of simply coming back to the legislature and asking for more?
Ms. Moti?
Mr. Chair, Senator Benson, we do have provisions in place under the contract with the vendor. I will say that our background studies division management team is in weekly, if not daily, contact with them, managing each and looking at all of the sites. Our overall capacity currently is about 20% of capacity is only being used and taken up of the available appointments. Now, we know that's not necessarily true for every individual site, and so for those sites that are having a higher volume, we continue to work with the vendor to make sure that they are managing that and setting up, standing up additional locations in that area more recently, as once they hit a certain transaction capacity level. So we do monitor it on a weekly basis, and there are performance measures in place in the contract to hold the vendor accountable on that. But overall, right now, we've only crept up to about 20% of available appointments each week across the state.
Okay.
Senator Benson?
Thank you. And Mr. Chair and Ms. Modi, so how are we going to push people to be getting these background studies? If we're at 20% capacity, that's a lot of room to grow. How are we going to increase the uptake of people who had the emergency study and not the fingerprint background check?
Ms. Moti?
Mr. Chair, Senator Benson, we are working with, and we have our communications that have gone out to the providers and the trade associations and all of our stakeholders. We'll continue to encourage and remind them that we have a current deadline of July 2nd that they need to come in, and that was part of our phased approach. We didn't want an influx of anything at any one point, and so that's what we're doing. We've communicated that multiple ways and held multiple presentations and working with the various stakeholders groups to be able to encourage them to start submitting that and getting that moving forward.
Okay.
Until right now, that is what's at our disposal to be able to move that forward.
Okay. Thank you. And
Senator Benson?
Mr. Chair, Ms. Modi, the BCA is step 2 in this, or step 3. Do they have capacity to push through this many, as the window squeezes here? Do they have the capacity to push through this many background checks? I know the governor requested additional funding for the emergency background studies grants. Are there any resources going to the BCA to make sure that they can expedite any new applicants?
Ms. Moti?
Mr. Chair, Senator Benson, That was part of the reason for our phased approach, is in conversations with the DCA, also worrying about the flow of studies that are going into them. And so that is why we've taken this phased approach. But as the window closes, there are some concerns that we're all both watching as to whether they'll be able to, all of us will be able to handle that capacity. But that was part of the reason for this very detailed phased approach, was based on a lot of conversations with our partner agency, the DCA.
Senator Benson?
Thank you, Mr. Chair.
Okay, thank you. Ms. Moti, I've got a couple here. You know, all along we've talked about basically the backlog has continued to grow. Where do we stand with that right now? Do you have a number that you can identify as far as all of those that are in that backlog category? What are we looking at?
Mr. Chair, we're not, unfortunately, that's not necessarily a number that we're easily able to identify. We know that 360,000 emergency studies were submitted to us, but we don't necessarily know if everyone is still on what we call an active roster or still employed at that current employer. How many of them may have been temporary workers? We know as we all know that our hospitals, our long-term care facilities brought in a tremendous amount of temporary staff. So we are preparing to be able to process all of them, because we feel like it would be the most prudent thing to do. But we don't know what that volume really is. It's a number that would be really hard to estimate at this point. We just know that we want to give our providers the ample opportunity to be able to, for those that are still on the rosters, to resubmit those fingerprints background checks.
Okay, thank you. Right now we're in a time period where we're kind of dual tracking. We've got all of those that they're in the backlog that we need to catch up on, and you also we're into the time when the new hires need to be fingerprinted right away. How do you identify the new hires from those that are in the backlog so that the new hires are processed in a timely fashion so that they don't just get lost in the big numbers?
Mr. Chair, that was again part of our phased in approach, asking when we initiated the studies, and we initiated it with our child care provider studies in September, to start with their new hires, and then at a later date, and there were several transition dates that we would have, start with the resubmissions on that. As things come into our system, we're not necessarily able to differentiate them between our systems, and I believe neither can the BCA. But that is why we had asked and worked with all of our providers and stakeholders to do a transition phased approach on this. And so that was how we were managing that.
And I think I caught it as it's just that transition phased approach. But every one of these individuals, when they are a new hire, they get assigned a number with a department, right? Is there a way to assign them a different series of numbers, or is there some way that we can not just rely on things just happening, but assign them a number so we know they're a new hire and we make sure they get to the front of the line because their job is depending on it?
Mr. Chair, and that's something that we took into consideration, but part of what we're doing in order to manage all of this also includes the system that we have to work with, and we have handling, this is our net study system, and handling of the emergency studies, transitioning and phasing coming out, are concerned about adding another layer of complexity into a system that is being asked to run at over peak capacity for a very long time. And so at this time that would have been quite a bit of system work, and I know for some it's hard to conceptualize if it's how we receive the fingerprints, goes to the BCA, ties back into us, being able to transmit to it. There's a lot of moving pieces on that, and that wasn't something that we were able to input into a system without more time. to be able to test it out, see if it worked, and make sure that there were no unintended consequences. Our primary concern on this is that as we were implementing this, we didn't want to do anything to the integrity of that system where we would have some very catastrophic problems.
Thank you. And as we know, we're coming up on the July 2nd deadline that we're supposed to be caught up with. Can you meet that? And I think I know the answer to that already, but can you speak to that? And what are your plans? When do you think the backlog can actually be caught up and made current? You know, we've got the July 2nd deadline that we're going to need input from the department on. What is real with the current vendor? And, you know, what does that real date look like? What do you guys talk about now as far as when you can be finally current?
Mr. Chair, yes, we have been having the conversations. We are concerned and think that it'll be tough to meet that July 2nd deadline. Our team has been working greatly with our providers and working to help them also when they're submitting the studies. And we have heard, like I said previously, we have heard from our providers that they're concerned that we wouldn't be able to meet a July 2nd deadline. So I think it would be prudent to extend that deadline to ensure that everyone has time to be able to submit it, that we're able to process it, the BCA is able to process that on it. So I think it would be incredibly tough to hit the July 2nd and probably not realistic.
But what would you, I mean, you've got to have some sort of a date in mind. What date would be workable? Or, I mean, July 2nd is coming up real soon. Is it 3 more months, or what do you foresee?
Thank you, Mr. Chair. We foresee that we think it would be, from a processing standpoint, from just a logistic or messaging standpoint, allowing this transition period to go through the end of this year, so through December 31st, 2022, and start everything completely fresh as of January 1, 2023.
Okay, thank you. Senator Curran.
Thank you, Mr. Chair, and I appreciate, you know, your line of questioning is, what are we going to do to get creative? And I was just checking to see, do we get regular reports to the committee? And it appears the backlog's growing. So what are those creative activities that are going to occur? Weekend hours? It doesn't look like we can keep up with the basic needs today, and it's going to take a pretty drastic step. And so what are those things? We're not hearing, Senator Utke or the chair just asked, you know, what are the options? And one of the answers is we haven't had conversations yet. It's going to take an extraordinary amount of effort to get caught up. And we just haven't heard anything creative. So I guess, you know, when you look at Senator Benson's bill we just passed, can we just, are any of the people who fall into that category of dual licensing, or to eliminate a certain segment of this group? What is that? I mean, I'm fairly frustrated that we're here and now it's March. July is going to come very, very quickly. And we don't have a plan. And the backlog's growing larger. We've been through this before, MNLARs and a whole variety of applications. And what are you going to do to report on I think at least a monthly basis to this committee, so we understand what's going to occur, and hopefully before we end the session that there's a real plan in place with a targeted set of activities and a projected due date. From what we're on is we're a year from now, we're going to be having the same conversation. So we would love to have some creative plan provided to us. And so with that, Mr. Chair, I know there's no question in there, a lot of frustration. And we would hope that we'd have some plan from you. And I guess could you do that for us and put forth a plan with the meaningful throughput, weighing everybody's options? What are those extraordinary efforts we're going to take What will the agencies do? Will you make our state facilities available? Senator Benson talked about what other things can we do? This equipment looks pretty straightforward and simple to use. How do we garner the people to get caught up? Our employers are critical, are in a critical situation, and the people who need their care are even more dependent upon it. So sorry for the frustrating rant, but we've been through this path before, and we're not getting any real answers. Thank you.
Thank you. Members, further questions or comments?
Mr. Chair, may I address one thing?
Oh, yes, Ms. Moti. Sorry about that. I was looking back and forth here at our table, not paying attention to the screen.
Thank you, Mr. Chair. I just wanted a couple of things to note for Senator Cran and for the members of the committee. That emergency study number is not going to necessarily continue to grow as we have resumed for our providers fingerprint background studies on that. And we have been processing numerous amounts of the fingerprint-based studies. I think we're at about 50,000 that we have already processed. And I just want to share with the committee members that the actual fingerprints in the criminal history information is just one component of a complete background study that we would need to take. There's a various different provider types. We have other information that we have to review and collect that may be coming from other jurisdictions on that. And as part of the special legislation last year, we have been staffing up internally for us to be able to handle that and to be able to process that. So we have plans in place. We have grown our staffing as much as we are able to in order to accommodate all of that.
Thank you. Members, anything further? Seeing none, thank you, Ms. Moti, for joining us here today and helping with the update and answering our questions. I guess we're hoping you rally your team, and we'll get a report here shortly down the road that talks about a lot of success. So again, thank you much for joining us, and we sure appreciate it. Members, anything else to bring before the committee today? Seeing none, we will stand adjourned for today. And members, next Monday and Wednesday, we're going to have a number of bills, so we're going to be busy looking at bills, and because we're getting down to the final week or two here before the deadlines start to hit, so we'll have a lot of stuff to look at. So thank you. We are adjourned.